Hey everybody, Dr. Brittany here at Bloomington Wellness Center. Today we're going to be talking about shoulder injuries and shoulder pain. Hey everybody, Dr. Brittany here at Bloomington Wellness Center. Today we're going to be talking about something inspired by the increasing amount of patients I have coming in lately with shoulder pain. Some of these people are young, some are old, some have definitive causes, and some of the pain is coming seemingly out of nowhere. The most important thing to remember about the shoulder is that it's not just one joint. It's a very complex system. Our shoulders are made up of 4 joints, 2 here in the front, 1 on the side, which is the actual joint that most of us think of as being our shoulder joint, where your humerus is fitting into your shoulder blade right here. And then we have one we call a false joint in the back, and that's right where your scapula is rubbing against the ribs and your thoracic spine in the back. And on top of that, you have multiple muscles, ligaments, tendons, we have nerves, we have bursa, and everything else that need to work in synergy and in balance in order for your shoulder joint to move properly and to work properly and to prevent you having pain. These days, what's tending to happen for most of us is because we're stuck at computers all day. Zach, adapt the computer posture. We're getting this rolled forward posture, and that happens in the back. It's happening in our necks rolling forward, and it's of course happening in the shoulders, or especially for most of us where our dominant side is spent on a mouse all day, or if it's spent using handheld devices all day. What's happening then is that the mechanics of our shoulder are getting really screwed up. This joint is rolling forward in the socket. The muscles in the front are tightening and they're becoming tight and weak, and then the muscles in the back are getting stretched out and they're always constantly overworked. So what happens then is when we go to move our shoulder and do the activities we normally do, we're causing a lot of improper mechanics, and then what's happening is we're causing overuse injuries in the shoulder, we're causing tears and rips and ligaments and stress injuries, and then we're also causing a lot of inflammation in the joint, which can then later on lead to frozen shoulder. So what we're going to do, the first thing we need to do, because the joint is so complex, is we need to do a really thorough exam in here and figure out where the pain is coming from. Do you have arthritis in your joint? Is it an irritated or torn ligament? Are your muscles just overworking? Or is it maybe just poor mechanics of the joint and things are rubbing and sliding wrong? Once we determine where that pain is coming from, then we can go ahead and jump into treatment for you. Now, some of that we can do in-house here, meaning we can do some adjustments to set that joint back where it belongs and make sure all these joints in your neck and your thoracic spine and your shoulder are moving properly. Sometimes it's going to be us doing some work on the tissues as well. And that means working on trigger points, loosening muscles that are too tight, strengthening muscles that are too weak. But a lot of that sometimes is going to have to be at-home work for you too. So what we're going to do is educate you on better ways to sit when you're working at your desk, or better ways to do those activities you're trying to do in order to help the shoulder joint function better. Some of it's going to be strengthening some of these muscles that are weak, and again, stretching those muscles that are too tight. And that's for you to do at home. There's only so much we can do at house without sending you home with some homework. But what we're always trying to make sure we can do is give you the most cost-effective and shortest treatment we possibly can. We always want to save you from having to do any costly MRIs or taking any unnecessary medications and things like that if we possibly can. If for any reason we do an exam in here and things aren't improving the way that we think they should, or if we think something more serious is going on, that's when we start thinking, do we need to do an X-ray? Is an MRI necessary? Do we need to send you to physical therapy or that kind of thing? But hopefully in most cases, what we're finding lately is that a lot of these shoulder issues are things that are very easily treatable by changes in at-home posture and desk posture, and then, like I said, at-home stretches, exercises, and things like that. If you've been experiencing any discomfort or any pain in your shoulder or think you might have an injury, feel free to check out our website and see what else we can do to help you.